I would like to take this opportunity to thank all healthcare professionals, our federal and local governments, everybody who's a critical supplier today to hospitals, to really, again, hats off and kudos for a job well done in trying to deal with this unprecedented virus and that's disrupted our country. It's been phenomenal to see people pull together all for a common cause. I know a number of our hospital partners and hospitals in general have not been taking full advantage of reprocessing. They've been trying to pick low-hanging fruit, things that maybe they didn't have to push hard against the OEMs on, or to really have a good conversation with the clinicians about the need to do it. I think we're going to see a shift from that. I think hospitals are going to need to be making sure that they are having the tough conversations both with clinicians and with their OEM partners about the need to save money. As we continue to see the demographics around ablations, it's continuing to grow, the demand for it. We see continuing increasing in technology, almost like an arms race in technology. And in order for hospitals to be able to access this technology, reprocessing must be part of their core strategy. We hear the phrase a lot from hospitals that the juice just isn't worth the squeeze. And when you look at hospitals that are saving in excess of $1 million a year from EP reprocessing, I would say there's a lot of juice for not very much squeeze. I think reprocessing in the EP space will continue to be a hot button. Again, back to the demographics of what's happening in the marketplace. We've got more people requiring the procedure. We've got device costs on a big upward swing. Last year, $3.25 billion spent on devices, $2.5 billion of that just on AFib alone. So it is a major growing problem. I think you will see more and more hospitals that are in this space focused a lot more to make sure they're getting maximum benefit of their reprocessing program. A well-run reprocessing program should be able to save a hospital in excess of $3,000 a procedure, and that means having the tough discussions around things like sensor-enabled catheters. As I approach 25 years in this industry, while reprocessing has grown tremendously over the years, the fact of the matter is there's still lots left to be saved from a rigorous pursuit of reprocessing. In the EP arena alone, there's $500 million a year we're leaving on the table in the United States in savings from catheters that can easily be reprocessed. So, great news, we've been growing the industry tremendously. Bad news is, or I guess probably good upside news, there's still a lot more to go. I think what we'll see in 2020 is a need for cost control, and EP will become more clear. Specialty reprocessors will continue to drive industry growth and savings for hospitals. Here at Innovative, we're getting more advanced clearances on microlumen devices, complex mapping devices, and I think, and again, on the specialty reprocessing front, we have the data and the sophistication to really focus the energy and the efforts to be able to drive higher savings. This becomes an advantage for hospitals through our partnership with Medline Renewal. I think the lesson that we learned from the pandemic is that there has to be a new deal made with large manufacturers in order to create space, flexibility in the supply chain, and to reduce vulnerability. We would encourage hospitals to not entertain new technologies that add cost without demonstrably improving patient care. The hospitals must demand that they get the full utility of the assets that they're purchasing from these large OEMs. This includes reusing single-use devices. We've seen it already with some large health systems that are demanding upfront that their OEMs start working with reprocessors in order to enhance their savings. I would ask all participants at HRS to take a look at the reprocessing program. Most hospitals only save about half of what they could save from reprocessing, then work with us to realize those savings. Reprocessing must be part of the vision to be used as a supply chain strategy.